Hi, I'm Joe Chilling, morning 7 to 9 on Buffalo's oldie station, The Big Wack. Joining us on The Big Wack's Buffalo on the Rise today is Dr. Ronald Gefaller from SoftWave Buffalo. Welcome back. Good to see you again.
Nice to see you too, Joe.
Give us an idea, kind of a refresher, if you will. What are we talking about when we talk about SoftWave therapy?
SoftWave therapy is something that's relatively new here. It's been FDA approved for about 7 years. It's been over in Europe for over 30 years now, and it's actually using technology that's adapted from working with kidney stones. So it's been around for about 50 years of technology. You're basically using sound waves to go ahead and create physical changes inside the body, okay? The sound waves are going to go ahead and reduce down inflammation. They're going to reduce down pain because that's part of inflammation. It's going to increase blood flow tremendously, about 200 to 400%. And you stimulate stem cell activities. And everybody knows about stem cells nowadays. All the professional athletes use them to go ahead and inject into joints to go ahead and get the joints to go ahead and start healing up better and faster. They're using it with cancer therapies. What we're doing is using the sound waves to go ahead and stimulate the activity of the stem cells that are already there to promote a healing response, so you can actually make old injuries start healing up again, and you can take fresh injuries and make them heal up even faster again. They use it for post-surgical wound care to get the wounds to heal up a lot better and faster, using it for diabetic ulcers and using it for neuropathies, even diabetic and chemotherapy-based neuropathies. You can go ahead and make your body make these physical changes that it just isn't doing or doesn't want to do. So it's a pretty amazing technology.
What kind of amazes me, and maybe the question that I don't understand, when you think about like a soft wave therapy or a sound wave with kidney stones, it helps break those up, right?
Right.
So how does this not damage whatever you're focusing it on?
I get that question a lot.
Oh, you do? Okay.
Well, with the kidney stones, you're using much more powerful beams, and you're crossing the beams across each other, so you're creating a shock wave effect inside the stone to go make it crumble. What they were noticing, the way this whole thing came about is that they were noticing when they were treating kidney stones, because the kidneys are up underneath the ribs, and as they were noticing that the bones in the ribs and bones in the spine would become much more dense. We were laying in more bony material into those bones during the course of the kidney stone treatment. So somebody had the bright idea over in Europe that, well, we have people that have fractures that don't want to heal up. After I broke my leg, I had a non-union of my fibular bone. It just healed up with scar tissue instead of healing up with bone. And with me, they did surgery, they put a plate in there, it was a big mess. What they found out that they can do is use that shockwave therapy again to go ahead and force those bones to start healing up better again. So you can actually take a bone that didn't want to heal and make it heal. And we all know that when you break bones and you damage things like that, a lot of times you do damage to the skin, the muscles, the ligaments, the tendons, everything else around there, right? Okay, because you have an impact. Mm-hmm. So they were noticing all those impact injuries, in the skin, the muscles, tendons, and bones, all those were healing up a lot better and faster. And so somebody had the idea, well, we do skin grafts over here, let's go ahead and work on the skin grafts. And so they started using it, because at that point they were taking skin off your thigh and putting it someplace else, and you had this big hole in your thigh that would take months to heal up, and so they started working on the skin to go ahead and get that to heal up in a matter of weeks. So we were able to go ahead and promote that healing of the bone and all those soft tissues a lot faster. Then it progressed into wound care and into orthopedics, is what I do.
So let's talk about, the viewer right now, practically, in a practical sense. What kind of things can you help them with?
Anything, it's pretty amazing. I've been using it for all sorts of different things. So I have, if you think anything that has an itis at the end, like arthritis or bursitis or tendinitis, things like that, it can help out with. Those are all inflammatory conditions. It can help anything with an inflammatory condition. Any kind of pain type of condition, normally we can go ahead and get in there and create a good effect on that. People with chronic back pain, muscle pain, scar tissue in the muscles. We do a lot of work with people that have post-surgical pain around knees and hips. They have large scars that are binding up that area and binding up the musculature. We can get in there and soften up the scar tissue and reduce down the pain and irritation, actually restore more normal function again to those joints and make them a lot more comfortable, a lot more functional. We deal with neuropathy patients that have chronic, foot numbness and pain. You can tremendously increase the circulation in those areas. You can actually make your body produce more blood vessels, because part of neuropathy is a circulation condition. And this is actually patented for nerve cell regeneration. Okay, it's FDA approved for that you can actually get the nerve cells to help get better again. I had chronic carpal tunnel syndrome. Actually, I had surgery done and came back 5 years later, and I happened to have the machine and started working on my wrists again to try to go ahead and get the pain out of my wrists and hands, get strength back again. Worked out great. Didn't have to have the second surgery done. I've got all the feeling back in my hand.
All right, now we've got about 2 minutes left.
Sure.
Let me ask you a couple of things that I think would be questions with individuals. Number one is it safe? And the other question is, how many treatments would be needed?
This is the safest thing that you can go ahead and do. You actually create absolutely no damage to your body. The FDA says that the side effects are negligible, okay, which means that you get maybe a little bit of redness temporarily, maybe a little achiness temporarily, okay? You're creating no physical damage. There's no needles going in. There's no downtime associated with this. It's probably the simplest thing you can go ahead and do. And the nice thing about it too, it has very deep penetration. You can get after some of those types of injuries that you can't affect from anything else except getting in there surgically. A lot of my patients, they don't want to have the knee surgeries. They don't want to have the knee replacements, hip replacements, things like that. You can go ahead and actually penetrate deep enough to go ahead and affect those deeper tissues and make some good physical changes on that. I'm sorry.
How many treatments?
Well, the treatments vary obviously per condition and per the age of the patient and their ability to heal. The average for most orthopedic conditions is about 8 visits, okay? You normally try to get that down more so. You use a lot more time and more intensive therapy than the average person will go ahead and do in the area to, I'm not patient. I want things to get better faster. And so we try to go ahead and do that for our patients there too.
All right, Dr. Gefaller, thank you very much. Really appreciate it. For more information and answers to your questions, contact SoftWave Therapy Buffalo by calling 716-667-6800 or go to softwavebuffalo.com. Sponsorship and promotional consideration for the preceding segment was provided by SoftWave Therapy Buffalo. And join me weekday mornings on The Big Wag.